like to thank the Minister for taking the time out of her busy schedule. If you've ever tried to get a hold of her, you'll know how busy she is, and she really does have a schedule that takes her all over the province and to just about every corner of every district that we have, and she certainly is dedicated to that portfolio. And I'd like to thank her for all of her hard work on really placing a high level of importance on the healthcare in Labrador. It really means a lot to us here. I'd also like to thank Tony for, well, congratulate him and welcome him on board. I'd like to thank him personally for his availability. And he said that we did have a constant dialogue, and that certainly is true. And that is literally every week there's always something. And unfortunately, when Tony sees me coming, it's always because maybe there's a constituency issue or a level of concern on behalf of an organization or a constituent. But Tony is certainly very accommodating and loves to see it coming and is very serious about helping me address the issues of the constituents. So I'd like to thank him for that. As I said, welcome everybody, and this is certainly one of the easier aspects of the job where you can certainly come up and applaud the Minister for yet another investment in Labrador and specifically in District Lake Melville. With this additional $1 million in equipment, people are going to be certainly better served. And as we know here in Goose Bay, I mean, if you talk about the North Coast, you talk about the South Coast, we certainly are the hub of Labrador. And if people have procedures and needs that are over and above the, I guess, you know, what's capable in the local community clinics, you'll see people traveling in and out of here. And this certainly makes us a center of attention. And what it allows for is to have, you know, a focus on where people could come, where people can be with their families and receive the care that they need. So I'd just like to thank the Minister for coming and thank Tony for always being there for me and trying to educate me on the ins and outs of how difficult it is in order to serve people, especially in the area of health. But I just want to talk a little bit about laparoscopy and the EKG machines and the ultrasounds. This is for the people, and we're talking about, you know, 33 million, I think it was, Minister, that has been invested here since in our facilities since 2004, and 13 overall in terms of equipment in our facilities since 2004. We're certainly well served here, and the people are certainly appreciative of that. I'd just like to say that, you know, in terms of all the people that come in and out of here, I mean, we certainly see our fair share of traffic here in Goose Bay. And in terms of the district, I mean, the people in Churchill Falls are appreciative of this equipment. The people in Northwest River are also appreciative of equipment. And what Minister Sullivan said earlier is that these investments allow us to serve people closer to their places of work and closer to their homes, which is her mantra, as she said, and is very important to us. I'll give you an example, and it's kind of funny, but as many people know, my mom and dad are from Northwest River, well, from here, but live in Northwest River now. And Dad had to come up here to the Lab Health Center here one evening, and he thought he was on his last legs. And we were all worried, and the family was called together, and turns out Dad wasn't dying. I had poisoned him with some bad shrimp. And if the EKG machine had been there, perhaps they would have known that in Northwest River, and there wouldn't have been a family-wide panic. But on a more serious note, my father actually was working in Churchill Falls when he did have some heart trouble and had to be medevac here at Goose Bay as well. And any, I guess, additional equipment that we can have in our communities throughout the district is certainly much appreciated. So without going on and embarrassing my father anymore, I'll basically say thank you to the Minister once again for the investment. This shows what our government is capable of and what our priorities are, and it certainly is in the healthcare field in our province. So thank you, Tony. Thank you, Minister. And I'd like to say to everyone, thanks for coming out to hear about the good news here today. Thank you very much.